Hello everyone, my name is Dr. Ganesh Gharat. I'm a consultant physician in Pratima Hospitals, Kachiguda. Today I'll briefly discuss about a very prevalent yet not so well recognized disease entity called metabolic syndrome, which is also known as insulin resistance syndrome or syndrome X. So metabolic syndrome is a constellation of various metabolic abnormalities like central obesity, which is raised waist circumference, abnormal lipid profile wherein there is increased triglycerides, which is considered a bad cholesterol, and decreased HDL, which is considered a good cholesterol, increased blood sugars, and increased blood pressure. The prevalence of metabolic syndrome has been increasing alarmingly over the past few decades all over the world, and more so in India. This is in part related to the sedentary lifestyle and consumption of excess calories, which leads to central obesity, which is in turn considered to be a driving force behind metabolic syndrome. So who are the patients at risk of developing metabolic syndrome? There are certain factors that determine the risk of individuals developing metabolic syndrome. Primary among these is obesity, particularly central obesity or overweight, sedentary lifestyle. It has been observed that individuals who watch television or phones or use computers for more than 4 hours a day are twice at increased risk of developing metabolic syndrome. The third risk factor is unhealthy dietary habits, that is consumption of carbohydrate-rich diet, sugar-sweetened soft drinks and beverages, and consumption of foods rich in saturated fatty acids. So what are the dangers associated with metabolic syndrome? So individuals with metabolic syndrome are at increased risk of developing atherosclerotic vascular disease, which includes heart attacks, which can lead to sudden cardiac deaths, brain strokes, peripheral vascular diseases, fatty liver diseases, and PCOS in women. Coming to diagnosis and management of metabolic syndrome, although earlier considered to be a disease of adult population, metabolic syndrome can also be seen in children and adolescents. Many individuals with metabolic syndrome do not realize that they have this disease entity unless they get certain blood tests done. This is the diagnostic criteria for identifying metabolic syndrome. Coming to management, once the individual is diagnosed with metabolic syndrome, management is primarily lifestyle and behavioral changes, medical management, and surgical management. As we have seen that all the components of metabolic syndrome are associated with lifestyle. Lifestyle and behavioral changes is the key and the most effective treatment for management of metabolic syndrome. The primary goal is to have a lifestyle modification so as to create a balance between calorie intake and calorie requirement. The lifestyle modifications include physical activity and healthy dietary habits with a short-term goal to achieve at least a 10% reduction in the baseline body weight over a period of 1 year, and the long-term goal is to have a BMI of less than 25. Diet rich in vegetables, fruits, legumes, whole grains, nuts, and fish is recommended. It is also recommended to avoid processed foods, foods rich in saturated fatty acids and refined carbohydrates. Coming to medication, these patients may require multiple medicines to treat the individual components of metabolic syndrome like hypertension, diabetes, and dyslipidemia. Finally, bariatric surgery can also be considered in patients with metabolic syndrome, particularly those with a BMI of more than 40. Thank you.